Director of Medanta. Appreciate both of you joining us. Both of you are perhaps some of the most familiar names in Indian medicine. Thank you very much for joining me. I'm going to come to you both, doctors, for questions that are coming in from across the country for you on this live social media interaction that we are having on the India Today e-Conclave. The first big question, and these are rapid fire at the start. Roughly 2/3 of all COVID-19 cases in major states, doctors, according to the government now, comprise people who did not show any symptoms, asymptomatic or mildly symptomatic at the time of testing. Does that mean silent spreaders are unknowingly infecting others? Does that mean there is a need for more extensive testing to isolate such patients? Why don't you start, Dr. Guleria?
I think this is data which has been coming for the last few days or weeks, that we have probably underestimated the number of individuals who are asymptomatic, and especially younger age group people who could have no symptoms but could have the virus and maybe spreading it. You must remember those who are not coughing, and if the chance of them spreading it is relatively lower, they still will have a chance of spreading the infection. And it seems that this number is not very low. Initially, it was felt it is 15 to 20% only. More recent data suggests that it could be higher. Also, there is another thing that is also emerging, that people who are even symptomatic may be spreading the disease 1 or 2 days before they develop symptoms, and that also is a cause of concern.
Okay, so this is a major cause of concern at the moment. You want to also respond to that, Dr. Trehan, this growing spread of cases of people who are seen as asymptomatic or mildly symptomatic who seem to be spreading, in a sense, coronavirus?
But this trend is no different than what has been seen in other countries. So it's not a surprise that asymptomatic patients can be infected. And also the fact, like Dr. Guleria said, that right before they become symptomatic, their viral load may be high enough that they become highly infective in the early stages.
Okay, let's come to the second question. And the second question is, there is also little clarity about the incubation period now, doctors, for COVID-19. World Health Organization told us 1 to 14 days, most commonly around 5 days. These the data seems to be varying now. How long do you believe is the incubation period, Dr. Guleria, for COVID-19? Is there any clarity?
I think we need to look at it in a holistic term. If you look at majority of people, the majority of people, actually the incubation period would be 5 to 7 days. And in most, it is up to 14 days only. But there are now a number of cases that are being found who may have the throat or the nasal swab even positive after 1 month or even 30 or 37 days. The question that is how many of such patients do we have? Not a very large number. And are they infectious? This data is not very clear. Having the throat swab in your, having a positive throat swab does not necessarily mean that you may be infectious. The viral load may have come down and you may not have that many viable virus in your throat swab.
Okay, let me come to the question, of course, that has caused a lot of confusion, and both of you may have different views on it. Dr. Trehan, confusion over the use of masks to protect oneself from coronavirus. Should a healthy person be wearing a mask at all times? Yes or no? Even in my house, should I be wearing a mask?
Well, certainly when you go out, you should be wearing it. I think that there is actually data to show that, look, it stops the droplets from coming out, whether it's somebody talking, coughing, sneezing, and it will, when we talk about asymptomatic patients, all the more reason if both people are wearing masks, the one who's infected and the one who's not infected and is not within 3 to 4 feet of the person, the chances of catching the infection is very low. So it stands to reason that you should wear it. There's no harm in it. Nobody's ever said anything that there's harm in wearing it. Yes, there was a little panic earlier that if surgical masks, people start wearing it, they won't be available for the medical profession. But it's been amply clear that a cloth mask 3-layer is quite effective. So people can make it at home. You can have 3 of them. You wash them every evening properly in soap and water, and you will protect yourself and protect the others from you.
Okay, so you seem to be saying that cloth masks, particularly for the average person, as effective as a surgical mask might be, in a sense, for, of course, a a health worker. But Dr. Guleria, I remember a few weeks ago you told me that you were not sure whether a mask was necessary. Have you changed your mind since?
So I think there is an evidence which is emerging that when we look at a cloth mask, which is a cloth cover rather than a surgical mask, it may be beneficial. And as you just
Yes.
pointed out, that we have a large number of individuals which we are now saying could be asymptomatic. So if everyone was to wear a cloth mask and not basically a surgical mask, then these asymptomatic people who could be spreading the virus would actually not be able to do so in a very efficient manner, and that would actually decrease the transmission in community or in society. The only other important thing to remember is that if you're using a cloth mask, be careful that you don't keep touching it. Some people get irritated by the mask and keep putting their hand onto their face, which can be a cause of spread of the infection. And do wash your hands regularly before you put on the mask and after you've taken it off.
Okay, so those are important rules that you're putting in a sense, Dr. Guleria there. Why don't you take the next FAQ, Dr. Trehan, that we've got from our viewers? There is Shweta who's asking, COVID-19 is known to be primarily a respiratory illness. Does the coronavirus damage only the lungs, or does it also now affect the heart, kidneys, intestinal tract, or liver and nervous systems?
It does. It is primarily goes through the respiratory tract, so the targets are the lungs. But once it gets, it breaks the barrier and gets into the bloodstream, it affects all organs. So heart, definitely, kidneys. So the basic thing is that it's not to be believed that it's only for the lungs. So people have gone into renal failure, people have gone into heart failure with this. So there is a problem. So it is not only lungs, it's everything.
Okay, that is again a statutory warning in a way. The next question, FAQ coming in, Dr. Guleria, you could take this. Are there any medicines or therapies that can prevent or cure COVID-19?
As of now, there is really no definite medicine which can prevent or cure COVID-19. There are a large number of drugs which are being tried. One drug which showed promise and which we're using as prophylaxis based on limited data is hydroxychloroquine, which we're giving to healthcare workers and people who come in close contact with a positive patient. There are other drugs which have been tried, which includes a drug called remdesivir, which has been recently shown by one study from the US that it may be of some benefit. Convalescent plasma is another type of therapy which has been tried and recently shown in a small group of patients that it may be of some benefit. But right now, I think we can't definitely say that there is a definite therapy. There are a lot of drugs which are being tried, but we still need to have more good trials before we can say that this is the drug which will be a game changer.
Dr. Trehan, a question that is being posed, antibiotics, effective in preventing or treating COVID-19, you believe?
Concomitant infections that may occur, like people who get their lung sort of attacked by the virus, can develop other concomitant infections like bacterial infections. For them, antibiotics is definitely indicated. And that's why we measure the white counts and all the other cultures from the respiratory tract to see if any of the adjuvant infections has taken place already.
Okay, the next one is hydroxychloroquine. There are again conflicting reports, Dr. Guleria, whether it actually reduces the viral load. Is HCQ safe? Can it be used as a prophylactic? Can it be used in your view?
So based on whatever data is available, it's an extrapolation of the lab data and the data on experimental animals, and two studies, one from China and one which has come from France, and a more recent study again from China, which has shown that it is also useful in what they call post-exposure prophylaxis, that someone who's had an exposure and they gave it to that person so as to prevent the viral load or significant viral infection occurring in the throat. All this data suggests that it may be useful and maybe something that one can try. Although, like I said in the beginning, we need more data, definitely good quality studies, but we don't have time for that. And based on a risk-benefit analysis, it seems that this is a safe drug if it is given to healthcare workers or to people who are under supervision, like close contacts. We are doing what we call a pharmacovigilance, that we're monitoring all our subjects we put on hydroxychloroquine for any side effects. There are some side effects, but none of them of a serious nature. But definitely, people who have a cardiac problem need to be careful because this drug can at times cause an arrhythmia or an irregular heartbeat.
Dr. Trehan, there's also the question about delivery boys that someone has put. Delivery boys and girls who bring in pizza or bring in food to home, or newspaper delivery boys. Do you see any at all concern that should be voiced? Because there was this one instance in Delhi that led to several people being tested then for corona positive, whether they were corona positive or not. Several of them quarantined. What's your view on this entire contentious issue of home delivery food?
So, Rajdeep, there are certain steps which the food manufacturer, the delivery process has to take to try to decontaminate every part along the way, including how the food is handled, how it is packed, how it is delivered by the delivery boy, and the fact that the delivery boy has got double masking when they go in touch with the delivery place. They should not be getting closer than 3 feet to the person they are delivering, and the person who's receiving should also wear a mask, in my opinion. And then you can actually desanitize the package as it comes to you, and the person who's bringing the food should be wearing gloves and then discarding the gloves after every delivery and putting on a new pair of gloves before they go to the others. Now, if you take all this, there is very thin evidence to say, or no evidence to say, that that has really caused transmission to any great degree. All over the world, the pizza delivery boys this is the most popular thing. They are delivering them all over the place, and no evidence has been found so far.
Okay, BCG vaccination program is the next question, Dr. Guleria. Is there a correlation between the BCG vaccination program of a country and COVID-19 infections? What's your view?
So there is a trial which has looked at the fact that the intensity of infection and the number of cases is relatively lower in those countries which have an ongoing BCG vaccinations at the time of birth. And that has led to this theory that possibly BCG vaccination may be useful. There are some other studies which have also been done in the past few years, which have looked at BCG vaccination in preventing other viral infections, with some lab data suggesting it may be useful. Based on this, it's been extrapolated that BCG vaccine may have a protective value. It may enhance your immune response, and therefore it may be useful. The Indian Council for Medical Research is actually looking at conducting a trial in the elderly population or the high-risk population to see whether giving them BCG vaccination may be protective. Currently, again, we need to have more data. There is some data which shows it may benefit, but this is not very clear whether it's a cause and effect or just a casual relationship between the study which shows that countries where BCG vaccination was given had lesser cases or less severe cases of COVID-19.
Okay, so the jury is still out on that. Let me come to other questions that both of you who run hospitals will be concerned with. The question that's now coming in is coming in from Raman. Raman wants to know, health workers are at a high risk of being infected. Several doctors, frontline health workers infected with coronavirus. 2 private hospitals in Mumbai, Wokhart and Jaslok. And we've also seen now other hospitals in Delhi where you've got government hospitals as well. Delhi State Cancer Institutes, which has 31 positive cases, including 22 health care workers. Are you worried, doctors, about hospital-acquired infection, especially for health workers, Dr. Trehan? As you run a big private hospital, is that a concern? And where is the gap in the system?
Most definitely, this is our concern. These are the frontline workers who we need to protect completely. So today, it is very clear what kind of protective gear that you need. In the initial stages, some of the hospitals got into trouble because they were not available readily, and the actual standardization had not taken place. Now, there is a very clear need for the proper PPE, including the mask, the goggles, the gloves, and the total body protection. Now, if you do that, the chances become...
What about scanning of all patients, doctor?
I'm sorry?
Doctor, what about scanning of all patients? The fear is there may be non-COVID patients who come for emergency care. They may be asymptomatic at the time for COVID, but may well, pass it on. So should the screening procedures change? Should they be more tighter?
Ideally, there should be. No question in my mind. But the point, as you know, every country is facing the same problem with the testing kits. And India also has now ramped up its acquisition and manufacture of testing kits. And as they become available, I think it's a good idea. And it should be that we should screen all the patients coming into the hospital if we want to actually prevent. Now, isolation wards have been made in every hospital, I'm sure, including Vedanta, where if there are patients coming in and there's any history or any suspicion, they are kept put into that isolation unit, tested, and then decide whether they need to go into the main hospital or they go into a protective facility.
You know, because Dr. Guleria, linked to that is someone asking, should pool testing of health workers be mandatory? Over 24,000 healthcare workers, including Max, BLK, Nanavati, will be tested for COVID-19 over the next few weeks. Should there be pool testing?
So pool testing is something which is being looked at. It's been already advised by the ICMR, but it's possibly to be done in areas where you are looking at a negative predictive value. That if all of them are negative, you can say this area or this group is safe. But if you have one positive, then you will have to test every one of them to see who was the positive one. So therefore, it's a difficult thing to do it among healthcare workers, because you must remember, if you are negative today and you have an exposure after 2 days, you could again become positive after 5 to 7 days. So becoming negative today in a healthcare worker does not mean that he cannot get the infection in the next day or two. It's just a 1-point test which says
but how do you protect, sorry to intervene, doctor, how do you ensure that physicians or health workers, nurses are more protected? Is it simply using better quality PPE? Is it better screening procedures for all patients when they enter the hospital as well as doctors?
So this is always going to be a tough question because of the fact that this is something which is happening globally. A large number of healthcare workers have got infected by COVID-19. And I think the issue is that you must have proper gear to protect yourself. As we've been saying, a large number of individuals can be asymptomatic, and you may have a person who has come to you with some other medical problem and doesn't have any respiratory symptoms. As for screening, you would feel that he doesn't have COVID-19, and subsequently he may turn out to be positive and have exposed healthcare workers who have not taken protective measures. So I think gradually we're moving in a direction where we would say have a low threshold for screening, especially patients coming to hospital, and consider have a high risk for considering people to be positive, and protect yourself even if someone has minimal or no symptom as far as COVID-19 is concerned.
You know, an interesting question also is coming, Dr. Trehan, and you, of course, are one of India's leading cardiologists. The question is non-COVID patients who want emergency care. Is the focus on COVID detracting from those who need urgent emergency care, whether it's dialysis, blood transfusion, whether it's cancer treatment? How do you respond to those who have this concern?
So one thing that we are routinely testing all the patients who are going to be admitted to the hospital. So that we encourage people who are coming for elective will get their test done the day before and will arrive with a negative test, and then they can be admitted and taken care of in an elective position. Emergencies is a different story.
Do non-COVID patients lose out? Are non-COVID patients losing out, doctor?
Well, with these precautions that we are taking, no, because see, the hospitals are totally divided away from each other. So there's no risk of infection jumping from one ward to the other, because there are isolation facilities. Like we have separated the two hospitals completely. So that is why if a patient comes...
And are they getting the same attention? Are they getting the same attention, doctor? Would a non-COVID patient get the same attention today?
Absolutely, no difference at all.
Pre-COVID?
Yeah, no, there's no differentiation. Okay. They are getting the same care as they were getting before, and we have to make sure that they will continue to have. So they are not losing out in any way. But one thing is happening, which you should know, is the fact that they are, because of the lockdown, many people wait till they become serious before they get to the hospital. So that is one of the things that we want to advise the public, that look, you can come with a proper prescription. You will be allowed to move out of your house with your family to go to the hospital. So if you are suffering from anything which is progressing, please do not wait till it becomes desperately serious. Come to the hospital and get treated. without any fear.
Okay, point taken. Dr. Guleria, National Health Profile 2019. For every 1,700 people, there is only one hospital bed in India. For every 10,000 people, one doctor in a government hospital. For every 610 people, there is one nurse. Are we ill-equipped at the moment, particularly in smaller hospitals?
So I think this issue has been there and the government has been considering this for many weeks. And we've been able to buy time by the lockdown in trying to prepare ourselves. Most states have now come out with their own plan in terms of how to have more ICUs, more oxygen bed, because I think that is a very important thing that we have to have more oxygen beds, and also developing how can you pool your resources at a district level, at a state level, so that you can get your resources consolidated into one place where there will be a hotspot or an outbreak. Remember, this pandemic doesn't happen throughout the country at one point in time. It will probably develop more in certain areas where you could actually focus on the healthcare delivery and then see where it is moving on to, and therefore sort of do it in a staggered manner rather than having to do it all across the country.
Doctors, I've got just a minute and I want to ask both of you that question. And it is linked to what was just said by Dr. Guleria, the lockdown itself. Dr. Trehan, today more than 1,500 fresh cases reported in the last 24 hours. In a way, it's the highest spike, especially big spikes in certain parts of the country. Do you believe that lockdown 3.0 is inevitable? A quick answer.
One thing the lockdown does is actually delays the process, and like Dr. Guleria said, has given us very valuable time to get prepared. We have been able to prepare COVID-only hospitals. We have got the supplies. The Indian industry has risen to the occasion. We have been able to manufacture ventilators, which are quite satisfactory for treating COVID patients. We have been able to manufacture our own PPEs. So definitely this has helped us to actually prepare very well for the onslaught when it comes. Now, if you think that there is a modulation which says if you lock up for 59 days, you may actually flatten the curve before you open. Today, it is of major concern that yes, the numbers are rising. And the fact that you say doubling rate is actually longer in the sense that it took 8 days to double, but that gives us a little bit of comfort, but not great comfort. It just shows that it's happening. It will happen. We better be prepared, and I hope it will not be as bad as has happened in some of the countries like Italy, New York, Iran, that we will be able to blunt it.
In that sense, Dr. Guleria, is the jury still out on how bad it could get in India? Do you believe lockdown 3.0 is inevitable? Because many other doctors say at the end of the day, the lockdown cannot be a cure. Either you will need herd immunity to be built, or you'll need a new drug or a vaccine to be found. What's your view? Will we have to carry on with the lockdown for a while longer?
So I think one issue is, from the health point of view, the lockdown is the best solution that we have right now. We need to see how we can do it in a graded manner, look at hot spots and cold spots and see whether we can develop a strategy. Because I also understand the fact that continuing the lockdown for a long period has its own consequence, especially on the daily wage people and people of the lower socioeconomic status. At the same time, we have no drug available. We have no vaccine available. Probably the only treatment strategy that we have is an aggressive lockdown, or making sure that hotspots remain.
So lockdown 3.0 inevitable, yes or no, doctor?
So to some extent, we will have to continue it in some areas, I think.
No, I will add here, Rajdeep. I can add here one thing. That as we open
very quickly,
lockdown, we must be prepared, and it is industry specific, how we have to actually plan it, that we will gradually, incrementally open up our facilities. So it should not be open willy-nilly, but every industry should have to put in a plan with the government to say, this is the safest way that we can open.
I think that's...
And that will be the only way.
That's very clear.
I'll give you an example. Just recently, we started planning, if planes are to fly, how would you ensure the maximum safety for the passengers? And we are developing the whole concept of saying, maybe we put them in some minimal protective gear, distancing in the aircraft, all management from
doctors
departure. So these are things, if we plan properly, I think that we will be as and we'll blunt it as much as possible.
Okay, let's leave it on that positive note, that there is a way forward, but we're going to have to plan for it. I appreciate both my doctors joining us, sterling doctors. Both of you have answered so many questions over the last few minutes. Thank you so much for joining us here on the India Today E-Conclave. That's it. Thank you.
Welcome.
Thank you. Thank you.
Kunal, speak to me.